and good morning, Kinaway community, and to all our friends in the business community joining us here this morning. We have an exciting, I'll say a deadly treadly webinar here for you today with a very extra special guest of whom I'll introduce in a short moment. But before we begin, I would like to acknowledge the traditional owners of the land in which I am coming to you all from. And I'd also like to acknowledge the traditional owners of the land in which each and every one of us are tuning in from, and pay respects to elders past, present, and emerging. I'd also like to remind you all that Kinaway are offering the usual forms of business support to all of our members and your families. So if you feel the need for any assistance of support of any kind, please feel free to get in contact with us, the team here at Kinaway. Okay, so now that we have all of that out of the way, let's give a warm welcome to our deadly guest, Professor Brett Sutton. Woo!
Thank you, Kitani. Thank you.
Thank you for joining us. So what I'm thinking I'll do is I'll pass the mic over to you and you can give a proper introduction to yourself because you'll do a much better job at it than I will, I'm sure.
Well, I don't know about that. Anyway, I'd also like to start acknowledging the country that I'm talking to you from. I'm in Wurundjeri country here in Melbourne City Centre and Naarm, and pay my respects to elders past, present and emerging, and to all Indigenous people who are tuning in now or who might see this in days to come. So I'm Victoria's Chief Health Officer. It's a big position. If you didn't know it before, you probably know it now. I've obviously played a pretty big role in responding to COVID. It's a statutory position to protect the health and wellbeing of Victorians for really any threats, disease threats, environmental threats that can come to us. And, you know, my key role I consider as being one of communicating those important health messages to community, and but also exercising those powers that also help to ensure that that protection happens. The last 2 years have been the hardest for many of our lives, and it's not an easy job most of the time, but it is an important one. And the work that the whole team's done, and really only as part of the entire Victorian community's response, has been really critical, and it's kept thousands and thousands and thousands of people safe. We can think about a lot of the struggles that we've had, and there have been plenty, but I often want to remind people just how bad it's been in parts of the world and continues to be, because the work that we're doing each and every day has made a huge difference, and we should never be complacent about how bad it can be with this virus. It's a really killer virus, and it's been devastating for many, many populations, including lots of First Nation peoples across the world. So we've done really well here in Victoria, and I want us to stay safe. That's my key job now.
Yay, thank you for that. I knew you'd do a way better job at introducing yourself. Excellent. Well, that is a great segue into the reason that we've all come here today. We're going to be talking about vaccinations. And then I'm really keen to get into this topic because, you know, personally, I have a lot of family and friends and will benefit greatly from this conversation. And I feel really proud to be able to be here with you, Brett, and we can go through it together. So that leads me to my first question. So the vaccine has been a bit of a hot topic here in Victoria, but also across the globe, with many who haven't yet received it, wanting to research a little bit more into it. So what are some of the myths that you and your team have come across, and what are the realities behind them?
Look, there's a million myths. There really is no end of them. But some of the common ones, I guess, are that the vaccine can give you COVID. That's not true. The vaccine does not include the virus. So the vaccines that we get include the materials that tell our immune system to respond, to say, look, here's some of the proteins that the virus carries, and to get our immune system ready to respond. The difference between being ready for an attack and not being ready for an attack is really what the vaccine does. It gives our immune system a taste of those proteins, not the virus, not the whole virus. And so it allows those, they're called killer T cells and antibodies to be produced so that when you actually come across the virus, they're ready to respond straight away. And that makes a huge difference to how ill you get, whether you get ill at all, and your chance of being hospitalised or dying. One of the vaccines, Pfizer vaccine, carries a little snippet of RNA, so a kind of nucleic acid, and that is used to code those proteins so that your immune system can then see them and build that immunity. So because it's a bit of nucleic acid, people have said, oh, that goes into your genetic material and changes it. Well, it never enters the nucleus of the cell. It goes into the cell, and then the machinery of the cell produces those proteins that then get presented on the cell for the immune system to see and think, oh, look, here are COVID proteins. We need to respond to these. These are not part of the body. So that mRNA has been framed as entering your genes and changing your genetic material. That simply doesn't happen. The idea that it can give you really severe side effects. Now, there are side effects that occur. There are mild side effects that probably occur in 40 or more % of people, depending on which vaccine you get and whether it's your first or second dose. So people can get fevers and chills. They can get muscle aches and pains. They might even be laid up in bed for a day. But this is against COVID that for vulnerable people, for people who are really at risk, has a 1 or 2% chance of putting you in hospital. And if you're in hospital, you've got a 1 in 4 or 5 chance of going to intensive care. And if you're in intensive care, you've got a really high risk of dying. And there are still 1.5% of people who are unvaccinated who will die. Now, I wouldn't want to go out on the street and put my hand up and say, oh, yeah, I'm good with a 1 in 100 chance of dying. Those side effects are playing against the really significant side effects of COVID. There's all this stuff about whether it magnetizes your body, whether it inserts a microchip. I really don't know how to respond to those. They are so out there that it's really hard to say. I do not stick myself to the fridge. I'm looking forward to getting my kids vaccinated if the vaccine gets approved. And that's part of what I would like to reassure people about, is that we are not charging ahead with this without months of data analysis that the Therapeutic Goods Administration, the TGA, and ATAGI, our top body advising on immunisation, going through all of the data to be happy that it's safe and that it's effective. The issue about blood clots, especially with the AstraZeneca vaccine, that was found out by our own regulatory agencies looking for those potential side effects. What's played out is that there are rare but serious side effects, including blood clots. But again, I would say, that's like a 1 in 200,000 risk of those blood clots for some people. A kind of 1 in a million risk of dying from that, which is much, much lower than getting in the car, than crossing the road, and is against the risk of getting COVID, where your risk of blood clots are really, really substantial. And again, your risk of dying is really substantial. I know a lot of people are concerned. I've got heart disease, I've got lung disease, I've got chronic respiratory condition, asthma, I've had a stroke, I've had cancer. A lot of people are concerned about getting a vaccine when they've got these pre-existing significant conditions. I would say you are the people who should be at the front of the queue to get the vaccine, because the risk of COVID when you've got those pre-existing conditions is much greater. And even healthy people can get COVID and die, but people who've got pre-existing conditions and some of the most significant conditions put you at most risk with COVID. They don't make the vaccine more dangerous. The vaccine becomes more important for you. A lot of people say, oh, kids don't get sick with COVID, so why do I have to worry about protecting them? They get much less severe illness. They are less likely to be hospitalised, but they are still hospitalised. And it's become a leading cause of hospitalisation for very young kids in places where the numbers are very, very high. You know, places like the UK that still gets 40,000 cases a day, or in the US with a couple of 100,000 cases a day. So kids in hospital has been a big feature because of the huge numbers who get infected. So I would say it's important to protect kids for their own sake. It's also really important to protect kids when we get a vaccine for them, for their close contacts, grandparents, parents, and everyone else who's in the household with them. And then finally, that you don't need a vaccine after you've been infected. Well, unfortunately, you do. Vaccination is an additional building of your immune response. When you get infected, you get an immune response. It's like your first vaccination. But getting a follow-up vaccine course is really important to get that full protection, because we know, again, lots of countries where people are being infected for the second or even the third time. And Iran is a place that had thousands upon thousands of people sick with COVID in the first wave, and they've had multiple other waves, and they've now got lots of evidence that people are going through their second and third illness, again with serious effects. So those are some common myths. There are billions of others, but I would, just ask people to go to their trusted source of information, go to your Aboriginal community controlled organisation, go to those Victorian Aboriginal Health Services and other VACCHOs to speak to someone you trust, speak to someone who knows about this and who has also heard where this information comes from and can debunk it. People get information from social media, and that is fed by some people who've got no interest in your health. They've got an interest in a cult following. They've got an interest in getting clicks. They've got an interest in getting followers, or an interest in getting your attention or your outrage, but they haven't got an interest in your health. So speak to someone who does.
Man, you put that so well. Ah, I am speechless over here. Yeah, I know a thing or two about social media, and I could not agree more. Brilliant. Thank you so much. My next question is, and I'm actually really curious to know about this one, but what do the vaccination rates for First Nations people in Victoria currently look like?
Look, they're pretty good, and they're better than a lot of other states and territories of Australia, and we should be super proud of that, about how we've gone about it, how we put VACCHOs front and centre, and how we put Aboriginal leaders and ambassadors and Aboriginal people first and foremost in promoting the vaccine and in having those conversations for people to get the vaccine. But it's not good enough. 85% is the first dose coverage for Indigenous Victorians. It's about 75% for that second dose, so full vaccination. That is really good, and we should be super proud of it. You should be super proud of it. But that 15% who are still not vaccinated, they're sometimes the most at-risk individuals because they have even more barriers for access for a whole bunch of reasons: financial barriers, transport barriers. They have other priorities in their life. They might be the most subject to misinformation. Or as I say, they've got all these other priorities in their lives, and it's not easy to get the vaccine in all parts of the state. And so a lot of effort's obviously going in with Star Health, with VACCHOs, with VARs to get those mobile vans out, and they're going to Shep and Mildura and Gippsland, but they need to get out even in Metro Melbourne, where those local individual conversations can take place, and we can really almost go door to door, street to street, to have those conversations and give people an opportunity to get their vaccine. So 85 and 75% coverage is great, but I'm worried about the 15-20% of Aboriginal Victorians who haven't yet received that full coverage and protection.
Yeah, and I think this leads really well into my next question, and it's something I really wanted to put to you and put to the community watching as well. But so I'll just read my question and then I'll explain. But Health Vic I was wondering if you guys have been able to find out any info around why members of the Aboriginal and Torres Strait Islander community haven't yet taken up the vaccine. I know you just listed a couple of reasons, and that's very true. And then I've said, or is that an important conversation that needs to happen within the community? I have a feeling, just listening to you, I think it is. That's an important conversation, everyone watching, that we should have with our friends and family. But yeah, I guess that's sort of just reiterating what you were just mentioning.
Yeah, no, you're right, Katani. There are those barriers that I've spoken about, but there are others that really relate to historical trauma. You know, Aboriginal people and the history of treatment of Aboriginal people in Australia is known to everyone, and it's an awful history. And so mistrust in government is part of that mistrust in the vaccine. You know, the government is behind the program to whatever degree in the procurement and distribution and the funding of it. And so people who don't trust government or don't trust government much will ask questions about what the motivations are. I'm an independent voice here. I work for government, but my interest is as a public health physician, is as a doctor who has, frankly, dedicated my life, my 25 years of work, to protecting people and to saving lives. That's my desire day in, day out. And so there's no other agenda I've got here other than to say I acknowledge that lack of trust. And you know, people who see government messaging might turn off right at the outset. So I would say, look, there are plenty of trusted voices in the community. Go to them, but make sure that they are health professionals and they've got the appropriate information in front of them. Because, you know, I could go to my own family and friends. I might get the right story from them. I might get accurate information, but I might get absolute bullcrap. And that's a risk if you're not going to someone who's actually got health qualifications or who has that information available to them and has gone through it in a way that has made them well informed. So, you know, I know another barrier is that Aboriginal communities in Australia and Torres Strait Islander communities have been largely protected from this virus for a long period of time. There are some parts of the country and Victoria that haven't seen a case. And so I think, well, why would I even risk a small risk with a vaccine if I'm not going to get COVID? I've tried to say to all Victorians, COVID is coming. We are opening up. We haven't got these restrictions and lockdowns in place, and we're not going to. And so it's going to spread with kids in particular, maybe, because they remain unvaccinated, but amongst the unvaccinated population and to a degree the vaccinated population, because it's not a 100% protection from transmission. So it's going to come to all communities. And if you care about yourself, if you care about your mob, then do it for yourself and for your mob. And, you know, I would say with any infectious disease, it's not just an issue of what it means for you. It's an issue about what it means for your loved ones and the people that you care about. So do it for yourself, absolutely, but do it with all of those people around you in mind, some of whom do have those chronic diseases and need that protection from you as well as for themselves.
Yeah, I couldn't have put it any better. I'm in an interesting position personally, Brett, because I live in Victoria, but I got all of my family from NT. So yeah, everything that you're mentioning is super relevant across the country. You know?
Yeah, and look, the NT has done so well, and again should be super proud. But as we know, the 19 cases that have popped up just in the last few days, having been kept out for months and months and months, they're all Aboriginal Territorians. So it comes, and we need to have that ready protection from vaccination before it does.
Yeah, it's an important message for just all mob across Australia. So I feel really lucky to be able to be sitting here with you, Brett, and having a yarn about it, you know. And I know I'll be sharing it with my friends and family, which everybody watching should be too. Beautiful. So, so for some of the younger First Nations, Victorian First Nations mob who haven't yet taken up the vaccine, but are now, because they've watched us, are considering / maybe needing some more support in taking that step. What are some useful resources that you guys might have or contacts that they could reach out to?
Yeah, look, I've got some written down. Obviously, there's your local Aboriginal community controlled health services. So your trusted GP, your Aboriginal health workers and nurses. There is a hotline, an info line. So the COVID-19 Aboriginal info line is 1800 312 911. That's open during business hours, 9 to 5, 7 days a week. And you can have a yarn with a culturally safe staff member to answer your questions about the vaccine. There's VaxFacts, so www.vaxfacts, vaxfacts.org.au, and Associate Professor Margie Danchin, who's well known in the kind of paediatric community, paediatrician from the University of Melbourne and a group leader of vaccine acceptance, uptake and policy at Murdoch Children's Research Institute. Answers some key questions about COVID-19 on or through that website. VACCHO and the Department of Health are currently adapting this into a more culturally appropriate series to share with the Aboriginal community, so look out for that. Koori Youth Council did a Young Mob Yarns Understanding COVID-19 Vaccines with Dr. Naree Blow. She's worked in my team, fantastic First Nations doctor with the department, and with nurse Kaylin Brown, a First Nations nurse with VARS, and that can be found at kooriyouthcouncil.org.au, and just go to the COVID-19 resources there. And finally, there's our www.coronavirus.vic.gov.au site, and there's a Torres Strait Islander and Aboriginal communities and COVID-19 vaccines page there. So that's got links to Koori videos and COVID-19 vaccinations around all of those safety and side effect issues that we've talked about.
Yeah, excellent. So all of those resources that Brett just mentioned, you guys, I will send out an email today with all of them there, so it's just a click away. I'm also thinking I'll make a page on our website so that it's more accessible to the broader community with just all of these links. You guys go there, check it out. Again, if you want a sort of just people to talk to about it, you can always contact the Kinaway team. We're always here. Or you could DM me on the social medias. Brilliant. So something that was interesting, when I was gearing up to have this yarn with you, Brett, I kind of found out a little bit about this, and I'm curious because I have literally no idea. But some members of the Victorian community have worries about how the vaccine may affect their fertility and safety. And Mum, if you're watching, don't worry, I'm not asking about me. I'm not going to have a baby anytime soon. But for those who do want to, then they worry that it might affect their fertility and safety. What advice and information do you guys have in your team for those who might feel a bit anxious around that?
Yeah, look, it's obviously been a question that's gone around. It's one of those legitimate questions to ask. You know, does this have an impact on me long term? But none of the vaccines that have been approved around the world, and none of those that have been approved for use in Australia, have any impact on fertility, short term or long term. Oversight by the TGA is a really important one, and they keep looking for these signals if it's something that might be an ongoing concern. So they will continue to collect data, but there is no evidence that it affects your ability to have children, or for men, your ability to have children, produce children. So there's essentially no evidence for it, but we'll continue to look for any safety signals, because that's the role of the TGA. They do it before a vaccine is approved, with the tens of thousands of people who've already received the vaccine in trials, but they continue, it's called post-marketing surveillance. They continue after the vaccine's in use, when millions of people start to get it, to look for these signals. And now, in Victoria, there have been over 10 million vaccines given and no signals. So a really good sign, but we're not complacent about any safety signal, and we'll continue to keep a lookout.
Yay, excellent. Yeah, that's awesome. I literally had no idea that was, a worry for some people. So I hope, if you guys are watching and you were worrying about that, I hope Brett has cleared that one up for you. But
yeah,
excellent.
Honey, I think some of it is because, there are lots of people who've received the vaccine. Of course, women get their period every month during their reproductive years. Some of them have missed their period. Some of them have developed some irregularity. Now, Once upon a time, they would have just put that down to these are normal things, or these are just variations in my cycle. But when the vaccine's rolling out and millions of people are getting it over a period of time, they might make that association. And so that's where part of these questions arise. What I would say is that those variations in your menstrual cycle happen all of the time. And of course, we've been through the most stressful 2 bloody years of our lives.
I
And
was
so
about to say that.
with lockdown and all of the other traumas that we've gone through in our working lives, in our home lives, of course that affects menstrual cycles and a lot of other things about our health. And making a link to vaccines might be a question in people's minds, but that's the reason why the TGA continues to look at it.
Yeah, that's so interesting. Yeah, because I'd never think other women were kind of feeling that way. It's fascinating. But I hope everybody feels a little bit better about, if that was a question in your mind. So I am aware of the time, Brett, and I am aware that you're probably the busiest human being in Melbourne. So that really wraps up my questions for you today. Don't worry, I'm going to get you back on here and we're going to do a Katani one where we talk about your favourite movies and your favourite video games. But that will be for another day. So thank you so much for joining me, Brett, and, presenting to the Kinaway community some of these facts and, some really important stuff. And not even just the Kinaway community, but the Victorian community as a whole. So Kinaway are super passionate about vaccinations and keeping the community safe. So we really appreciate you taking time out of your day to yarn with us. So thank you.
My absolute pleasure, Katani. Thanks for the opportunity to have a yarn. And I'm as passionate as you are, and I'd love to come back at some point. So thank you, and thanks to everyone.
Yay! Awesome. So you guys, I know we've had some comments coming through. So keep leaving your questions. I'm going to work with Health Vic in getting those answered accurately. So keep an eye out for those ones. I would also like to thank you all for joining us. Special thanks to Professor Brett as well, like I have said, for stopping by little old Kinaway TV. We hope you all enjoyed it and feel a little bit more informed about vaccines and vaccinations. So I encourage you all to share this stream with your friends, your family, and even your networks. Because let's be honest, it was an awesome webinar. So again, if you wish to catch up on previous yarns like this one, go to our Facebook and our YouTube and you'll find those all there. I just want to, while I have you guys, remind you, if you need wellbeing support or support of any kind, you can always call up 1-800-KINAWAY or talk to the team. We are always here for you. So thank you again, everybody. Make sure you go and follow my new butter boy, Brett. And we shall see you next time. Bye, everybody. Bye, bye, bye.